Hi, I'm Dr. Gary Arthur. Welcome to Lunch with the Doc. And we are going to do a special today about soccer and soccer players and some of the common things that we've seen in treating soccer players. We've just recently been treating 4 professional soccer players, and I just thought I would explain some of the different kinds of injuries that they have and how we fixed them and got them back onto the soccer field and helped them return to a career, because these are people that this is their livelihood. This is how they make money, is by playing soccer. And especially with World Cup right now, we just thought, well, let's do a little special on soccer. So let's start off with this. If we think about soccer, soccer is a really interesting sport because it utilizes speed, it utilizes agility, it utilizes coordination, it utilizes a lot of mechanical gears are having to be at work to play soccer. So we thought, well, let's go through and we'll tell about 4 different professional soccer players and some of the injuries that they came in with, and then show you how we fixed them and got them back on the playing field. So the first thing, these are the 4 main injuries. Now, the first one was chronic hip pain that radiated from the hip. There's the hip joint here, but the whole hip was engaged and hurting from the low back.
Hey everybody!
All the way. There's Maria. She's been getting the camera
Happy
set
Wednesday! Lunch with the Doc. Woo-hoo.
And so this patient, first one, had pain all the way around the hip to the front, and every time he's running, he's getting pain. That's not good for a soccer player.
Not good.
The second one had a knee problem. I'm going to show you what the knee problem is and what the cause of the knee problem was. And he basically couldn't play for a year. So they basically thought he was going to be out of commission, and he's basically getting paid. So the team was motivated to get him fixed up. All right, my man.
Got our knee.
Here's our knee model too.
Our knee model. We're showing you all the models. This is so fun.
Yep, this is fine.
I like this.
And
Story time.
and then the third one had an abdominal strain right here. He had a pulled abdomen. It was an abdominal strain, which is kind of like what happened to LeBron James on Christmas Day. And every time he would kick, he'd get this sharp jolt of pain right in his lower abdomen. Where the abdomen comes down, see this red line here? That's where the rectus abdominis, where people get a six-pack. Those that have those six-packs that actually show. Some of our six-packs don't show as much because there's a layering over that doesn't allow you to see. But they're there. They're underneath.
They're underneath.
You have a six-pack, right?
Wait. 20 years ago.
20 years ago.
Where are we? We didn't even say
we're at Gigi's.
We're at Gigi's Bistro today. We
lovely
love
place.
Gigi's.
Love the food. We're going to be eating just after the talk is over. We send a lot of people here that are gluten-free and want really good, fresh, quality food. So this is, I think, our 3rd time we've done a lunch with a doc here.
Yep.
So then the 4th player came in, and he doesn't have an abdominal strain at all, but he has pain when he's running and when he's kicking. And what we found with him is he has a psoas muscle that's been pulled and injured, and now it's built up scar tissue all the way around it. The psoas muscle is involved every time he brings his leg forward. The psoas muscle is having to engage to kick and to run. This is the psoas muscle. It's a hidden muscle to most people because it's in here. It's underneath. It's underneath the intestines. It attaches to the lumbar spine and to the lumbar discs, and it goes underneath the inguinal canal and comes down on the inside of the hip down in here. So it's called a trunk flexor. And so this guy's problem is that this got injured before. He points to his pain right here. It got injured before, and it actually now it hurts to touch it. But when I did a kinesiological evaluation, because I'm a certified applied kinesiologist, and you can actually start to figure out, why is this person's body not healing this thing on its own? I've got to do the detective work to figure out, why isn't it healing? What do I have to do to get this guy back? because he's a really good soccer player, but he's not functioning. He's not able to play right now. He took time off, a month off actually, and just started to go back, and the problem was still there. So it means that we just no one was able to figure out why the problem was happening and what to do to actually correct it. So that's what we'd like to talk about. And then the last thing that's interesting with soccer players, and I've got a fifth player, and she's a female soccer player, and her main problem is neck problems. And what happens if you think about the fact when that goalie kicks a ball and clears it down to the other end, and their head is sitting up here, and they do a header, and that ball comes in like bam, like that, to their neck, boom, they can have sprains, strains, whiplashes of the neck. So my fifth one is a female, and her main thing is neck problems because of playing all the soccer, and her neck is filled with scar tissue and adhesions in there from all the traumas to her neck of heading balls and things like that. So
we have some good stretches that we give people for the neck.
Yeah, there's a whole way to fix a lot of these things. So which one do you want to start with, Mo? Should we go with the first one?
Yeah.
Okay.
Let's go with
the first soccer player.
Start at the very beginning. Very good place to start.
So the first soccer player, really good player and phenomenal player, but he was just being hampered with this chronic hip pain. Here's what we found. When people get injured, bam, like that, what happens is that muscles, tendons, ligaments can all get overstretched and actually torn. What we found is that the physiologists have found there's a 3-day inflammation cycle after an injury like I just showed you. And then for 12 weeks, the body has a repair stage where it starts laying down reparative tissues called scar tissue, also called adhesions. If it's not kept moving while those scar tissue layers are being randomly laid down, then what happens is you get a big wad of scar tissue that surrounds the joints and starts to restrict their motion. Now I can tell with the sacroiliac joint, as you can see here, a famous doctor, Dr. Gillet, found that if you engage the hip and you bring it up like this, the sacroiliac joint actually should move as the leg comes up. So we can actually measure. Well, this soccer player had 10% of normal motion on that sacroiliac joint as I brought his legs up to measure it. It just wasn't moving. The reason? Old injury, bam, he got tackled hard a number of times, over and over and over, scar tissue, spasm. Now the joint is not moving like it should. He's lost his flexibility. Now every time he runs, he's still doing this, but it's not moving like it should. It gets more inflamed, lays down more scar tissue, more inflamed, so layer upon layer upon layer. Now, instead of the joint moving like it should, the muscles are being asked to do way more movement than they should, and that starts to develop bursitis of the joint, tendonitis of the muscles where they attach. And so what we had to do with him is twofold. We had to give him home care exercises and stretches. We used something for a lot of our patients called the Hypersphere. They also, the same company, Hyper Ice, makes a Hypervolt, which is a handheld muscle massager, and they also have a foam roll called a Viper 2.0. And we include that into our home care regimen. So I had him leaning back against this ball that has 3 speeds of vibration in it. We did a lot of tissue work to loosen up the scar tissue, deep tissue therapy, gentle adjustments to re-establish normal range of motion. And also we did Graston work. Graston is an incredible work. We gave him exercises to do in our clinic, and we also did active release technique on him to start reestablishing normal motion. We also, with him, we asked him, well, do you want temporary relief or do you want more long-term relief? He goes, I want to fix this thing for good so it doesn't come back. So we did postural x-rays on him in the process, we found that there was a distortion where his spine was over here, and then it went like this, and then it went like this, and then instead of his neck being where it was out like that.
Uh-oh.
So he had all these other, strange distortions, and we said, in order to fix something so it doesn't come back, you have to try to restore the body back to its normal mechanical functioning position that it was designed to be in. So we've been doing a lot of work to start bringing this back over, to bring this back over, and to bring the neck back, and he's gotten better and better and better. So we got first focus on getting his symptoms back so he could be able to play. Secondly, we've been doing the work to rehabilitate and restore and remodel his body and spine back to normal, and it's worked fantastic. So that's case study number 1.
So I have a question about him. So how long did it take for him to get out of this hip pain and to be able to play again like he was before?
Well, with him, he's like one of the main stars on his team. What we had to do is we had to give him a little time off. There were a couple of weeks where we had to take him out of playing, and then we had to bring him back kind of slowly so that he wouldn't just re-injure himself. But initially we had to see him 3 times a week for a few months to really get some momentum going, and then we were able to start cutting back from there where he didn't need to be treated as frequently. Now we only see him about once every couple of weeks for kind of like a tune-up and oil change. We just keep his body moving. That's his wellness care, his preventative care, since we've already got his spine and everything fixed and remodeled. Much like putting braces on crooked teeth. You leave those braces on until the teeth are straight. You keep on tightening them to get them straightened, and finally, you get to take the braces off, and now it's a process of wearing the retainer and making sure that it's working. So
do you, what has he said about his playing since he's gotten care?
Oh, he's playing better than ever.
That's awesome.
Yeah.
Cool.
Yeah.
Love it.
Second guy.
Number 2, tell us.
Chronic knee problem that had been out of commission for a year and had all kinds of physical therapy and
so he couldn't play
treatment.
For a year.
Yeah, for a year.
Wow.
Yeah.
That's
and we
not
are going to
fun.
put in our order soon, but we're going to do this first. So with him, what this guy had was a similar type of problem, but how it affected him was that it was causing a distortion of his knee. So here's our knee model, and here's what had happened to him. His glute up here on the right-hand side was twisty. It was so tight. What it was doing, it was twisting his femur like that.
Oh.
And as a result, because this muscle up here was so tight, it was twisting the femur, which is the thigh bone, was twisting it out like that. Now look what it does to the knee. When this way, when this twists like this, here's what's going on inside the knee.
Ouch.
And now we're running, and it's not in the groove. It should have been like that. Instead it's like that. And then it takes the patellar tendon here, it takes it with it as it comes and rotates this way. It takes the tendon with it. All of his pain was above and below the patella right in here because the attachment was twisting it, and then he was playing. And so what we had to do with him, his main thing is we had to decrease the inflammation around here, and then we had to work on fixing the distortion that was twisting it, and a lot of that came with the same kind of care where we're going to adjust the sacroiliac joints, we're going to do the soft tissue work around the glute and the SI joint and start to release that, give him home care, do in-office care. That was a really tough case. It took a lot of work. I also had Dr. Lee, my favorite acupuncturist, do some work on him too, which really helped to move him through the process a lot faster. And now he's back to playing some of the best soccer of his life, and you know, it was a long, very frustrating, very depressing time for him because here, you know, people are wondering, like, why aren't you playing? Are you just milking the system? Are you getting paid to play soccer but you're not playing soccer? And it was very frustrating for his coaches, the team owners, himself. Everybody was frustrated with the process. So
But he got back in there.
he got back in there. He's back to playing great.
Yay!
Yeah.
Woo! Victory stories.
All right, now
Number
number three
Yeah.
was the person with the abdominal strain and pull. What I found with him is his injuries that had happened had caused a lot of adhesions, and it was torquing his pelvis. It was pulled up like that.
Ooh.
And so his pubic bone was not sitting correctly, and it was causing pain. Every time we tried to kick, he would get this sharp shooting pain in here. So same thing with that. We had to rehabilitate, remodel, get range of motion restored back here on the SI joints, break up the scar tissue, give him home care, you have him use the hypersphere, the foam roll, and reestablish normal range of motion. His case really only took about 2 months to resolve. That was great, but he had been out for a number of months from a professional team. That's case number 3, victory number 3. Number 4 is a new one that we're just starting with, and what I found with him is this psoas problem. We haven't fixed it yet, but we have figured it out. We took postural x-rays, we saw some distortions, and we also were able to find out what muscles were too tight and adhesed, and what muscles had become weak, so that we could explain why things weren't working the way they were supposed to, why he has symptoms. And he says, yeah, I've gone through 3 months of PT and I'm no better. Then I took a month off and I'm no better as soon as I went back. So we're hoping to get him back on the playing field quickly. That's number 4.
Woo!
Number 5 is the girl that played soccer and bam, and bam, and bam, and bam, getting tackled from behind. Lots of trauma to the neck. And so what we found is that her posture, instead of looking like this, looked like this, forward and off to one side, instead of being laid like the normal would be. So you can see it's straight here and it's pulled off to the side. So we have to look at, well, there's tissues that are too tight over here and too stretched over here. So we've got to strengthen these muscles and release these muscles to bring a person back towards normal. And we're working with her right now to get her back to playing. But you know, she's been playing soccer, doing headers ever since she was a little girl. So it's quite a process to go through. So anyhow.
So what would you say for all athletes out there that are listening? What's a way to prevent some of these injuries from happening in the first place?
Well, I would say number 1, if you've had an injury, unless there's an absolute full tear of a ligament or tendon, keep moving it while it's healing over those 12 weeks afterwards. Try to decrease the amount of inflammation early on. Ice it down, 20 minutes on, 40 minutes off. There are nutritional and supplement protocols to help ligaments to heal and to help tendons to heal. I have a whole protocol that I put people on. Blueberries are great for any kind of tendinous injury. Blueberries, and then we have a whole bunch of different supplements that we use for that. And then, get checked out. I mean, it doesn't cost a lot to really get checked out by a certified applied kinesiologist somewhere. You can look up the ICAK-USA, and those are doctors that have been certified in applied kinesiology, how to find this stuff, how to figure it out, and then really work on how to correct it. A lot of times you're going to need deep tissue work as well to come alongside the work that an applied kinesiologist is going to do, but you're also going to need to take a look at the posture. And the doctors that are best at that are listed under the idealspine.com website. And it may be that you have to see certain practitioners initially, like an applied kinesiologist, to figure the problem out and get your pain levels down. But to fix the posture afterwards, a lot of applied kinesiologists aren't really trained in doing postural corrective care to the degree that some other doctors are, and that's why I send people to the Ideal Spine website, so you can also learn about fixing the posture.
That's good.
So those are, I think, the key things.
And on that point, we do both applied kinesiology and Ideal Spine corrective care.
Yeah.
So coupling kind of it all together.
Yeah, and with nutritional care too. That's one of the reasons why we keep on getting referrals from these pro soccer teams to help fix their players up. So
That's good.
yeah, we're grateful. And it's been great too, is I was just going to say, I've had the opportunity to work with some incredible athletes, gold medalists in volleyball, indoor, outdoor, all-star NBA basketball players, all NFL quarterbacks, top surfers in the world, some of the very best surfers in the world I've had a chance to work with. It's been a lot of fun because these people are really motivated to get back to their sport, and sometimes they just want to keep on training. So you have to find out, okay, what kind of training can I have you do so that you can allow that part of your body to heal, but you can keep strong and keep aerobically fit. So it's been really fun.
Yeah, it's super fun. It's
sports medicine.
It is. Well, it's so cool because it's like we, treat people from all different parts of life, but the athletes are really fun because they're super motivated and they know their why really well, to get back on the field and do the things they love.
Right.
It's cool.
One of them is so motivated right now because he goes, you know what, if I can move up in the levels to the highest level of soccer, my earning capacity for me and my family is just going to go way up if I'm a better soccer player.
Yeah.
So instead of maybe playing at this level, now he's recruited because he's that much better than everyone else. He's going to move up to the next level. So,
that's good.
Yeah, it's pretty fun.
What fun stories.
Yeah.
I love it. So for all of you out there, if you get an injury, check it out. Keep it moving, keep it stretched, all those things. Those are really important. And then we have a very special day coming up tomorrow.
Yes.
4th of July.
Yep.
Yesterday, Dr. Gary did a little health tip Tuesday on staying healthy and balanced during your 4th of July. So some really good tips about, if you are going to be drinking some cocktails or fun drinks, what supplements you can take to keep your body balanced, to help your liver support detoxification.
And not have a hangover on Friday.
Not have the hangover the next day.
And then a lot of people don't drink. A lot of our patients don't drink, and that's fantastic. And then just stay hydrated and keep yourself healthy. Don't allow your blood sugar to go way up and down.
With the
too
sugar.
many desserts and stuff like that.
Keep it level. And then if you're going to be in the sun a lot during the day, obviously wear sunscreen. But super important, a lot of people just, will get the sunscreen from the local drugstore or whatever, but a lot of those sunscreens have a lot of chemicals and toxins in them, so you really want to make sure that you're getting a non-toxic sunscreen. So really good place you can find that is Roots Beauty downtown in Laguna Beach. They're amazing. I get so many of my products from them. They're all non-toxic. They give you a little card that is the Dirty Dozen. It provides 12 different chemicals that you should be looking for in all of your products, making sure that they're not in there because those will soak into your bloodstream in 26 seconds and then you get the bad effects of all those chemicals in your body. So you can also go to Whole Foods. Just make sure you're getting really non-toxic products, no fragrance, because that can be filled with, I think there's like 150 chemicals that can actually go under the name fragrance in ingredient listings. So you want to really make sure that you're getting clean products in your sunscreen. So wear sunscreen, make it clean, and keep hydrated. Wear a hat. And have fun.
Have fun.
We talked about a balanced life a couple weeks ago, and celebration is part of those things. So enjoy your 4th. Also coming up on the 25th, Thursday the 25th of July, we're doing another 7 steps to relieve neck and back pain workshop. Those are always really fun. People love to come and learn 7 steps that they can do, something that you can implement daily into your routine for 10 minutes to help prevent neck and back pain and relieve it. So
and we teach you some stretches and things like that to do that are good general things. And we even feed them, don't we?
Yeah, we feed them. So it's dinner and a workshop, the 25th at 6:30. So mark your calendars for that. And enjoy the sun. Have a good Wednesday.
Signing off.
Signing off.